I really felt like I was going to die soon, and I wouldn't be there with my wife to raise a family like we'd always dreamed of. My name is Brandon Claybo. I'm 30 years old. I work as a police officer, and I've been a detective for the last 3 years. My entire life I've been really healthy, but in the fall of 2023, I noticed that I was short of breath while I was working out, while I was running at the gym. So after a few months of still having the symptoms, not getting any better, I made an appointment with my primary care doctor. She listened to my heart and heard a heart murmur. Then she immediately referred me to a cardiologist. He did an echocardiogram, and he said, "I'm going to call you an ambulance right away because it's pretty severe what I'm looking at." Hearing there was something wrong with my heart was scary. What also scared me was thinking of my wife, who was 7 months pregnant at the time. My diagnosis was chronic thromboembolic pulmonary hypertension, or CTEPH. I had numerous and substantial blood clots in my lungs. Those blood clots restricted the flow of my blood from the heart through the rest of my body, and that is what caused a sick, enlarged, and failing right side of my heart. The cardiologist at the hospital told me that CTEPH is very rare. There's only a few select hospitals in the country that can do this, what he described as a rare, complex surgery. I'm not only going to be hooked up to a lung and heart bypass machine, but they have to cool my body temperature down to around 68 degrees Fahrenheit, and they have to stop my heart from beating, and they have to stop blood from flowing through my body for a 20-minute time period. I was referred to Northwestern, and I met with pulmonologist Dr. Milvaganam. He really gave me a sense of confidence and instilled some faith in me that this is a treatable disease. The surgery lasted 10 hours long. It was in the ICU for 2 days. Immediately, I felt much better. My stamina, my breathing. After my surgery, I was shown a photograph of all the blood clots that were removed from my body. And after seeing that image, I realized how serious my disease was. I remember, telling my son through my wife's belly numerous times, like, just please hold on, don't come out yet. Just wait till I'm out of the hospital. And thankfully he was listening, because once I was discharged from the hospital, my son was born the very next day. I'm so thankful at Northwestern, and because of Dr. Chu, Dr. Malazery, and the whole surgery team, my son has a father who's present, who's healthy, who's living a life with them without any restrictions. And there's not enough words that I can think of or say for how much thanks I have for them.